Hi, my name is Dr. Atif Alvi. I'm a specialist colorectal laparoscopic and general surgeon. I have been trained in the United Kingdom and I have been working in colorectal surgical department for the last 10 years as a consultant, and overall my experience in the National Health Service is about 20 years. The main purpose of this talk today is to discuss bowel cancer screening program and awareness in general population about the risk of colon cancers and how to prevent it. So the screening population is generally asymptomatic, which means they have no symptoms. That's why it's difficult to invite people with no symptoms as they assume they are normal. But in general, anybody over the age of 40 nowadays does carry some risk factor to develop bowel cancer in future. So the best prevention is to catch the problem at early stage and deal with it. First risk factor is the age factor, family history of bowel cancer. Secondly, change in bowel habits, blood in your poo, weight loss, unexplained weight loss, loss of appetite, feel any lumps in your tummy or in your back passage. What family history means: if you have any first degree relatives with bowel cancer, especially at a younger age, for example, your parents, your siblings, or any second degree relatives which are 2 or more in number, you should be wary of the cancer in the family, because some cancers have a genetic predisposition and they are more common in those families. Therefore, it's important to know your family tree and who in the family has bowel cancer. In United Arab Emirates or in Middle Eastern countries, the incidence of bowel cancer is growing quite rapidly, and much younger age group is being diagnosed with bowel cancer. Therefore, in UAE, the screening population starts from 40 plus. And the screening basically detects and checks your system if there's any problem there. Colonoscopy is the gold standard procedure which involves inserting a camera into your back passage and check the whole colon, which is a direct visualization of the colon on watching on the big screen, and it can detect polyps, any growth, cancer. Why are we doing screening? The main purpose of screening is to pick up any problem at a very early stage. For example, if you pick up a cancer which is at stage A, it can be treated with surgery or removal of that growth, and success rate of cure and 5-year survival is almost 95% or plus. Whereas if something is picked up at a later stage, which is stage C or stage D, in which the cancer grows bigger, go out of the bowel, and it travels into other organs like liver and lungs, then the treatment options are minimal. We cannot cure the disease, and the survival chances are almost nil. Therefore, I would like to encourage everybody to get themselves checked up, especially anybody over the age of 40. In screening program, what we can find is either a simple polyp, which is a growth, a benign growth, which starts in the bowel lining. The polyp is not a cancer, but it could be precancerous. If it's removed at the time of colonoscopy, it's a very minor procedure. You could avoid developing a cancer. If you find a cancer, then we have all the facilities at King's Hospital to deal with that. A lot of people will not have any symptoms, but anybody over the age of 45 should get it checked out at least once in 5 years with a colonoscopy. I must re-emphasize again that getting yourself checked at an early stage will save your life.